Greetings and welcome. Hello, everyone. Welcome to our presentation this evening. So this evening, we will cover an array of topics, including cardiovascular health, sexual health, HIV PrEP, and mental health. And we hope that our time together this evening will be enlightening and empowering. Thank you to our sponsor, Gilead Sciences, for making this program possible tonight, and to our partners, Omega Psi Phi Fraternities Incorporated, 12th District.
This evening, I'll talk about cardiovascular health, and hopefully this will make a positive change for yourself or give you some guided work, some guidelines and a framework to help to make a positive change. The cardiovascular system is one of the most important systems. I mean, if you think about it, it's one of the first things we look for in determining if there's actually life or death. It does about main four functions. So it transports nutrients and gas around the body. It protects our body from infection and blood loss. It helps regulate body temperature and maintain body temperature. It helps us to maintain fluid balance. Those things are very important. Cardiovascular health is extremely important because it is the #1 cause of death in the United States. And it's been that way for quite some time. In fact, the American Heart Association has actually identified 7 contributing factors that involve the vulnerability of cardiovascular health. #1 is smoking. In Black population, we tend to smoke fewer cigarettes, but we start smoking cigarettes at an older age. We're more likely to die from smoking-related diseases than other groups. And we're also targeted a lot more in spite of the fact that we're slightly less prevalent in smoking compared to whites, but we're targeted more. #2 problem is poor diet. African Americans 2 times as likely as whites in the past to have a healthier diet. Now, not so much that way. The other component is sedentary lifestyle. I mean, the prevalence of the sedentary lifestyle is higher in Blacks, for sure. Obesity is higher in Blacks. More pronounced in women than men, Black men, but still, nonetheless, we've got a lot higher. Other effects is hypertension. We've also got cholesterol and elevated glucose levels. In fact, the #1 cause for sexual dysfunction is cardiovascular disease. And the #2 is all those things that I just previously mentioned. We're talking about smoking, sedentary lifestyle, obesity, hypertension, cholesterol, elevated sugar levels. All of those things that contribute to cardiovascular health are #2. So it stands to reason that we should definitely take our reins for cardiovascular health, as it will not only affect our overall health, but will affect our sexual health. Thank you.
Men want to be sexually active. Men want to be sexually healthy. And if you're in a committed monogamous relationship, that is the safest way to have sex. But there are so many people who are not in that situation. And for them, we have to talk about risks. You can minimize your risk by minimizing those factors which are known to contribute to why STDs occur, and also the transmission of HIV. That's what we're talking about today, staying healthy. We have to talk about gonorrhea, chlamydia, syphilis, also herpes. Those things are still out there, and if you're not wearing condoms consistently, you are at high risk of transmitting those diseases, both to your partner and receiving them. And then we're going to spend some time talking about HIV. Currently, there are 1.1 million people infected in the United States with HIV, and there are nearly 40,000 new diagnoses each year, as recently as 2017. And among those people who are getting HIV, 81% are males, and most of them are persons of color. So what contributes to HIV risk? It depends on the likelihood of the partner that we're having sex with having HIV and the risk of a specific activity. If you are sexually active without knowing the HIV status of your partner, or you are having sex with someone who is actively HIV positive, that is the highest risk for transmission of HIV during sex. And if you have sex in the transgender community, A remarkable statistic is that 56% of Black transgendered women are living with HIV infection. So condoms are an important way to moderate the risk of HIV transmission, but they're only about 80% effective because most people don't use them consistently. Injection drug use with shared equipment is also a great risk factor. And if you have had a bacterial STD like gonorrhea and chlamydia or syphilis and it's been diagnosed in the last 6 months, you or your partner is at very high risk for HIV transmission. And there are certain behaviors which are also more risky. If you're having sex with people who are living with HIV infection, if you are having transactional sex, which means that you are paying or exchanging favors for sex, that is high risk behavior. If you are a man having receptive anal sex, that actually is the highest rate of transmission. That's 10 to 15 fold higher than heterosexual contact without condoms. There's still a risk of HIV transmission with heterosexual sex, but it's not nearly as high as unprotected anal sex. It's very important to know and understand your risk for HIV and to be screened so that you know your status. You can discuss that with your partner and make sure that you know your partner's status. But that brings us to PrEP, which is pre-exposure prophylaxis. Combined tenofovir and emtricitabine, also known as PrEP, is an excellent way of reducing transmission for HIV. With once daily use, you can reduce your risk of transmission of HIV down to almost zero. Go into your doctor and talk to your doctor about your risk, get screened for HIV, make sure that you are HIV negative, and then you can be prescribed PrEP. PrEP is fully covered by insurances with no copay. But if you're not able to meet the copay for some reason, you have insurance that doesn't allow you to get the medicine, Gilead Sciences has a program to make the medicine more affordable and reduce copays even further. We have PrEP and it's readily available. So talk to your doctor about PrEP. If you're a woman who loves a man, encourage him to know his HIV status by going and getting tested, and then encourage him to get PrEP.
I like to always start off things with data. In 2018, in terms of proportions of new HIV diagnoses compared to other ethnicities, African Americans are 13% in the United States total, 37,966 HIV new diagnoses. We got to do a better job in terms of education and getting folks out there to get tested and doing some better behaviors and handling of health professionals and mental health support. Racism and homophobia, the biggest issues for Black men, which hits them from what? Every community. Those are the two challenges that stand out. Rejection historically and is ongoing discrimination and racism. Those have always been there in terms of internalized racism. That what does that mean? Isolation, despair, shame, fear of disclosure. Talking about, hey, look, I have this problem, I need to get tested. So those things we internalize as men and don't do these things that's important for their health. Judgment is also an issue when it comes to stigma. In terms of anxiety and depression, play a huge role in accessing and receiving care and treatment. Also, those two interactions increase the likelihood African American men do not secure HIV tests and delaying care. And then the question is, does those who are impacted by HIV/AIDS deserve it, the support and help? And that's a stigma that's oftentimes we need to look at. Portion of related to racial inequality, the refuse casual contact is an issue. Isolating members of a community is a challenge. Referring people to HIVers or positives. Those are inequalities because you're referring to those are not humans. Those are inequalities and those things need to be removed in terms of offering support. In terms of coping, what are some things that Black men can ways to cope? Um, Support from your counterpart. Seeking medical and mental health support is critical. Group or one-on-one attention, whether it's one-on-one with a psychiatrist or LCSW, it's imperative because it helps you process so much of these things. What does an African American woman or woman play in a man's life, an African American man's life who's dealing with HIV and AIDS? You have to crack that barrier. You have to also, as a woman, understand that's a challenge. So understanding your man is important. Number two, educate yourself. The other piece is for yourself as a woman, you're also dealing with coping mechanisms and also seeking support. So this way, you know that you're not in this by yourself. It's a collective effort to support the Black male. And I think that's where a woman really needs to understand, I'm not in this by myself. I cannot do this by myself. If I can summarize everything, it is to understand the male. It is to embrace that person and to slowly, with the support of medical or mental health professionals, to help them reach that goal of being tested, to get the servicing quicker, and to know that this is not the end of life, that there is an opportunity, which I have seen men live 20, 30 plus years, and also the promotion of folks like at Gilead with the help of ABWP to let folks know that we are here for them and that we need to do a better job promoting HIV. AIDS is not the end all. There's a end of the road for many years to live. Thank you so much.
How does chronic stress in the workplace affect heart health?
In terms of chronic stress at the workplace, as a manager, oftentimes I would see staff not being able to keep up with work, scheduling, being able to see foster children in a timely fashion. If they have 30-something children in a monthly time frame, compiled with court visits, so many things, they would not be able to do those things. So definitely when the stress is impacting, eventually your well-being is impacted and your heart's impacted. So you have to find time for yourself in between and be able to prioritize.
Can you speak on the unique challenges of being a Black man in America and the amount of stress that it has on you? And then also to your experiences you've had in the medical community, in seeking medical services, if there's been any form of discrimination or lack thereof, resource accessibility, things of that nature.
I went to the hospital with my wife, and we saw a doctor, and he didn't know that either of us were physicians. My wife is a veterinarian, but in any case, we have a obviously clearly strong background in medicine, but he essentially treated us kind of like we didn't know anything at all, and gave us the very highlight diagnosis and didn't do any explaining as to how the management should go further until I actually stepped up and probed him a little bit more, little by little. And he actually realized at that point that I was a doctor. And so he had to go back to the drawing board and kind of reinvent himself and reinvent his presentation towards us. So oftentimes there is that, even within the stuff that I see, is the racism within the medical profession. I see it there. From a cardiovascular standpoint, it actually acts as like a fight or flight response. And every time you're under stress, your body generates a lot of adrenaline. It's almost like you're getting ready to fight, you're getting ready to argue with somebody. Your body needs to figure out a way to cope with it. So what it does is it squeezes the heart, starts to pump the heart a lot more as the blood pressure increases to try and give your body fresh energy, fresh blood to the organs that need it the most, which is usually the extremities and leaves the gut. So all that long-standing exposure taxes the cardiovascular system. It has to work harder for an extended period of time. I think as Black people in general, we kind of wake up already in a little bit of stress due to the fact of racism, due to discrimination. I think we wake up already having to think about, how's my shirt look? How am I going to behave myself today? I better behave a certain way. Those are things that white people or white or Asian or whoever don't really have to think about on a regular basis. Those little micro things that we have to think about create additional little levels of stress, and that taxes us through time.
The question reads, I found that a lot of the standard guidelines that are out for health parameters don't necessarily align with all segments of the population. I've been referred to specialists by my primary care physician, only to find out that the parameter that was out of range is common for most African Americans. Is there data that provides those guidelines by ethnic groups, and where can we find those resources?
But usually the CDC is probably the number one go-to to give you a little bit more accurate information. But yeah, more of the specialty websites are often a lot better to give you more detailed information, to give you current guidelines.
I use the United States Preventative Services Task Force, which informs a lot of the guidelines of the American Academy of Family Physicians. Their website is accessible for common patients as well. All of this is done in conjunction with having a relationship with your primary care physician.